Namaste, I am Dr. Sandeep Nayani, consultant neurologist from Apollo Hospitals. Today we shall bust some myths regarding migraine. Migraines are relatively uncommon. So migraine is a very common disease. It is experienced by 20% of patients, 20% of people at some point of time in their life. So it is so common, and it is the most common symptom for which anyone seeks medical attention with a neurologist. Migraine is just another headache. Migraines are quite severe headaches characterized by severe one-sided throbbing headache along with symptoms like nausea, photophobia and irritation to light and sound. So people who experience migraine are incapacitated for up to 24 hours or sometimes more than that, and because of which they may not be able to carry out their routine daily activities. So migraines are not just any other headaches, they are quite significant and severe headaches. Migraine is a women's disease. Though migraine is common in women, it is not exclusively a women's disease. So migraine is seen very commonly in women. Up to 80% of migraine patients are women, but it is seen in men as well. 15 to 20% of migraine is in men. Most doctors can diagnose and treat migraine. Though migraine has very simple symptoms and signs, it very frequently gets misdiagnosed. Unless someone takes a detailed history regarding headache and correlate all the symptoms properly, it may be misdiagnosed as a different condition like a sinusitis or a refractive error of the eye. So it is important to consult the right consultant or the right doctor regarding your migraine headaches. Migraine only lasts a day. So migraine duration varies from person to person. In some people, migraine episodes may last half a day or little less than that, but in most patients it lasts more than a day, and in many patients it can last up to 3 days. The headache may wax and wane. It may come down after taking medication and again again increase after a few hours. So migraine episodes don't just last a day, they can last for 2 to 3 days, and they can be recurrent. More importantly, migraine episodes are recurrent. They subside and then they may recur after a week or after 2 weeks at varying intervals in different people. So migraines are not one-day headaches. Migraine is something that you learn to live with. Migraine patients commonly experience migraine attacks, and it impairs their quality of life and it affects their functioning at their workplace, but it is not something you can learn to live with. However, there are certain measures that patients can take to prevent the episodes from happening so frequently and prevent the headache severity. All migraines are same. Migraine is a disorder which can present in different ways. In some people it may be unilateral, in some people it may be both sides, in some people it may present with nausea, vomiting, in many people it may present without any nausea. And there are many types of migraine, like migraine with aura, without aura. So migraine can present in multiple types of way rather than in a single way. Only an imaging exam or a scan can diagnose migraine. So in most cases of migraine, you don't need a scan because migraine is a clinical diagnosis. Whenever someone experiences the set of symptoms like headaches, episodic headaches with nausea, vomiting, photophobia and phonophobia, we can treat them as migraine. Most of the times we don't need a scan, only when they have any abnormal signs or any other associated features, or when there is a doubt that the condition is not migraine. Only in such situations we need to do an CT scan or an MRI scan of the brain. Over-the-counter pain medications offer migraine relief. So migraine attacks in some people can be very frequent, and keep on taking over-the-counter pain medications can be harmful because they can damage kidneys and cause various other side effects. So it is not advisable to take over-the-counter pain medications frequently for migraine. It is better to consult a physician or a neurologist and then take treatment appropriately. There is nothing to do to prevent or manage migraines. Migraines are very well manageable with some lifestyle modifications. Severe migraine episodes or frequent migraine episodes can be prevented by taking simple steps like eating meals on time, sleeping on time, avoiding certain triggering foods like chocolates, cheese, sour foods, and avoiding exposure to hot sunlight, drinking enough water. These simple measures can very well control migraine attacks. True migraines come with an aura. So, in up to 20% cases of migraine, patients experience aura-like symptoms like blurring of vision or dark spots or shimmering light in front of the eyes. But aura is not a must to diagnose migraine. In fact, in 80% of patients, there is no aura associated with migraine. Living in a better climate is a migraine cure. Although certain climatic conditions will benefit patients with migraine, no climate can completely abolish migraine, or change of climate is not the solution. All we can do is avoid all the triggers, avoid exposure to sunlight or extreme heat is what we can do from our side to prevent migraine episodes. So today we busted most of the myths about migraine. Migraine is a disease which happens with unilateral headaches characterized by nausea, vomiting, photophobia and phonophobia. It can be prevented by taking certain measures, by eating food on time, by sleeping on time, and there are medications that can cure migraine, and migraine can very well be controlled by following regular dietary habits and regular sleep habits. Thank you. Stay safe, stay healthy, stay informed. Thank you. Namaste.